transparently, efficiently and effectively, with due accountability to the public and the donors and the international community as well. We have designed now a system that will be more robust, sensitive to the needs of the population, will be accountable to the population, and all processes would be implemented in the most transparent manner. We have designed now a system of digitalization of the health ministry. At the federal level, some success has been already implemented in that domain, and our data system IDMIS that takes care of almost all the vertical diseases, and the IDSR is another big contribution towards that. But we would like this system to be implemented right at the BHU level in the digitalized manner. So in the BHU level, the health center level, the data, instead of these registers manually, it will be transformed into a digitalized network. Analysis will happen at this facility level. We will build the capacity of the health system at the BHU level. We will equip them. There is a plan for it. And then the same data set will go digitally to the districts, and from districts to province. We already have a system for that. And at the national and federal level, we have a digitalized analysis system. So that's how we can ensure transparency in the system, and also to assess how we are going, whether we are going in the right direction or the wrong. So the data and evidences will guide us. Any system that is responsive to the needs of the population and believes and go by data are least deceived by the challenges. The challenges would come. Pakistan is a resilient nation. Everybody knows Pakistani bravely fought against all kind of terrorism, wars, climate change impact, climate catastrophe like floods, natural disasters like quakes. But we showed resilience. And the same resilience we would like to be incorporated into the health system as well. So now, thanks to the British government, we have entered into a partnership with the British government whereby our health system would be made climate resilient. And for that, a framework has already been developed, and it will be operationalized after due consultation, so that the health system is enabled to better respond to any climate change catastrophe, reduce the risk of the population, and also address the morbidity and mortality associated with the climate catastrophe, as we witnessed in the 2010 floods and 2022. Honorable DG Sahab and friends, I am so excited to learn that we would continue our journey towards one health, better health, one plan, one approach, and would ensure that the system, whether at the primary level, at the secondary level, is strengthened enough to provide quality care services to the population. Whenever I visit the field, I compare both the tertiary, secondary level healthcare system and the primary. Unfortunately, the primary one is still deprived of many things. Just on the way to this center, I visited a health center, and where plethora of challenges were mentioned by the doctors and the paramedics regarding the HR, the medicine supply, the equipments. So that's our responsibility, not only in this health facility, but in consultation and cooperation with the provincial health teams. We would ensure that our primary health care system is so developed that the rush and the influx of the patient is reduced in the secondary and tertiary health care center. If you visit PIMS hospital, you will see patients with diarrhea, coughing, fever, headache, and some functional cases, all overload and flood the PIMS hospital and also the federal hospitals. If we strengthen our primary healthcare system, we invest in it, we build the capacity of the health system, then this rush and this heavy flood of patients would be better managed at the primary level, and those patients which need further specialized care will be shifted to secondary and tertiary level. So a referral mechanism, we are envisaging a functional, viable referral mechanism to be put in place, so that a referral once is made to the secondary and tertiary healthcare hospital, then the same provider is provided the feedback regarding the outcome of his intervention and his referral, whether the patient got treated and cured or still in the hospital, because this will build the trust of the community in the health system. If we address their needs holistically, if we engage the community in our interventions, provide ample space to the communities, they would trust the system. Now, what I see at the primary level, because the services have been disrupted and not prioritized at the primary level, the people has lost confidence in the primary health system. And that's why if you give a preference to a patient for a primary healthcare center or a far off secondary healthcare center, his or her priority will be to go to the secondary and tertiary healthcare center. We need to break this, sir. And this is for the betterment of the health system and the people at large, because they incur a cost. Distance, cost, opportunity time lost. If the person is a daily wager, they lose the money also. So instead of taking pains to go to a far off facility, if quality primary healthcare services are provided at the basic health units and RECs, and this trust is boosted of the public, they wouldn't bother to go to the secondary facilities. So that's how we envisage the system. We are signatory to the universal healthcare, and as part of that universal healthcare coverage, we have in the country a system of universal health insurance. You all know about it. But our vision is one country, one health, and one approach. So I have advised the Qawmi Sehat Card team to consult with all the provinces and come out with one uniform system. Of course, the advice was that we would ensure that 20% of the poorest of the poor are provided with free inpatient healthcare services everywhere. That's taken for. But those who have the ability to co-pay, for that a mechanism is being chalked out, that with very little money they and their family are enlisted into the system and are availing the system free of cost for inpatients. So if we succeed with the provinces and design a one health insurance system, that will be a Qawmi Sehat Card system and will be implemented across the board. But consultation has started on that. It's not yet final. Once it's finalized, we will share, and that will be the biggest gift that we in the interim period can provide to the nation, with the hope that we would do and continue our best for the public, the society, and the nation. I beg leave now, but our doors are 24/7 open, not only to my health professionals and colleagues, but to every citizen of Pakistan. He or she is most welcome to inform us of the problems,